we're here at the annual meeting of the profession, the American Counseling Association. And what, from your observation, both of the field in general, what you've kind of seen here, what do you see as some of the really interesting, emerging or exciting, sort of hot topics that are going on in the profession? You know, as a counselor educator, as well as someone who has also been a provider of treatment. Just what are sort of things you see are emerging and really exciting to the counseling profession?
Well, at this convention, as is at most mental health profession conventions this year, there's a lot of buzz about the DSM-5, which is about to be released in May of this year by American Psychiatric Association. So a lot of the sessions are focusing on what are the changes in DSM-5, talking about diagnosis and treatment of mental disorders. But at the same time, the emphasis in the counseling profession has been in the past 10 years about social justice, leadership, and advocacy, and how we can work to change these larger cultural systems and fight the social injustices that have been occurring in our culture for so many years. So there's been sort of this disconnect. Yes, counselors address mental disorders, and we do provide diagnosis and treatment, but we need to put all of our efforts over here in working to change the culture. And how do those two come together? And I think that we're finally starting to recognize we can't have this gulf here. We need to bridge that gap and say, yes, some of us are called to do the social justice and advocacy work, but without neglecting the fact that we also need to be able to provide the best practice treatments for our clients that do still come to our offices and still expect treatment.
Right.
So that's what I think is exciting about my book, is that I've been able to think about those ways about bridging that gap. How do you provide the prevention and treatment that girls need, not only just for when they come to your office and you provide that one-on-one setting, but what about early interventions in schools or through community groups, empowerment groups, and then what are things counselors can do to change this negative, very toxic culture for today's girls.
Right. It's sort of the need is to sort of look at the whole person, in their environment, as well as the person as an individual. It sounds like that's what's needed for bridging those gaps.
Right. We can't just look at a person in a vacuum. They're not just a depressed adolescent girl. It's a girl who's experiencing depression because of things related to her family, her peers, her school, her community, her neighborhood, as well as the overall, the macro culture. We have to attend to all those areas.
Well, Laura, thank you so much for joining us today.
Thank you.
And once again, the book is called Adolescent Girls in Distress, A Guide for Mental Health Treatment and Prevention, published by Springer Publishing Company. Be published in 2013. So congratulations on the book, Laura.
Thank you, Nancy.
And we'll be looking forward to reading it soon. Thanks.